Should you start a telemedicine practice straight out of school, or should you get some experience as a nurse practitioner first? Let's talk about it. My name is Tiffany. I'm a certified family nurse practitioner, and I provide practical advice and insight to the aspiring nurse practitioner entrepreneur based on my own experiences. Welcome to my channel. Since I've been helping other nurse practitioners launch their own telemedicine practice, one of the most common questions that I get all the time, whether it be on my clarity calls, my Instagram, and my email, is I'm a new graduate NP and I want to start my own practice. Can I do that, or should I work for someone else first? I will always have the exact same answer for that question, and it is: take inventory of your own skills. What does that mean? Yes, you need experience before starting your own practice because you have to think of it very practically. You will be the only provider in that practice. You will be the sole one making decisions. So you need to be confident in your skill set and know that you can recognize red flags based on the services that you will be presenting in your practice. You need to recognize red flags and know when it is safe and when it is unsafe to treat a patient on your platform. That may look different for every practice. If you decide to launch a virtual urgent care practice, then you need to recognize the red flags for the top 20 chief complaints that an urgent care would see in a day. Is it okay for you to treat that pneumonia? Or is it okay for you to treat those pneumonia-like symptoms? Or does this patient need a chest x-ray or IV antibiotics? Is it okay for you to preemptively treat that UTI, or is it better for this patient to first go to microbiology so that we can get a better idea of what we are treating? You have to be able to recognize red flags for every condition that comes into your telemedicine practice in order for you to deliver safe and effective care to our patients. Now that we've decided that you definitely need experience before launching your practice as a nurse practitioner, let's talk about where you can get those experiences. There are 3 different ways that you can get experience before launching your telemedicine practice. Number 1, clinical rotations. So during your clinical rotation, how much of the work was hands-on versus shadowing another provider? Did you get the opportunity to go into the patient's rooms, do physical examinations, take an HPI, create the care plan, decide which medication to prescribe, decide which lab work or diagnostic imaging needed to take place, and determine the follow-up plan? Were you able to do all of that in your clinical experience? Or was it more of a sit back and watch the provider do it and you learn a little bit, take some notes, but you didn't get to actually be the provider in those clinical situations? If you did have an absolutely amazing clinical rotation and you were able to feel exactly what it would be like to practice independently, then I would say that you had a very good clinical rotation, and that experience can be used towards your telemedicine services if they do align. So whatever services and whatever chief complaints that you did in your clinical rotation, I would advise that that's what you do in your telemedicine practice. But that is very good experience. That's how I got my experience. My clinical rotations, my last 2 semesters of my clinical rotation was extremely independent. I went into the patient's rooms. I was the one who, talked to the MAs. I ordered the POC. I ordered the lab work, medications, create the care plan, discuss the follow-up plan. I was very independent in my clinical rotation. So when I graduated, I knew I could confidently practice in a family practice or a walk-in clinic because I had a good year of experience already underneath my belt. Number 2, prior RN experience. There are some roles as a nurse practitioner that greatly aligned with what you did as an RN. For example, psych NPs. If you practice as a psych nurse prior to becoming a psych NP, you are more than likely more comfortable treating psych patients independently because you've been around them for years. And everyone knows that RNs do a lot of the work, and you can become very familiar with the medications that need to be prescribed, who is contraindicated, what to expect, what are the side effects. You become an expert. Another one is labor and delivery or pediatrics. Those are pretty much aligned with RN and NP. It's just that now you have the credentials and the prescriptive authority to take your care a little bit further. So that is another way that you can get experience before launching a telemedicine practice as a nurse practitioner. Number 3 is work experience. So the other way to acquire experience is to actually first work as a nurse practitioner in whichever discipline that you would imagine opening or starting your own telemedicine practice in. So that way you can acquire further hands-on experience, good quality experience. Use that time as research, enjoy it, take full advantage of all the resources that are offered to you by that position through that job. So that way you can be the best practitioner possible and also be confident in your skills and your ability to take care of patients on your own platform when that time comes. In conclusion, I recommend that all NPs have experience before launching a telemedicine practice on the side. However, the quality of experience significantly supersedes the quantity of experience. So even if you have 5 years of nurse practitioner experience, but it's all in acute care, and now you want to launch a pediatric practice, those don't really align. You have to make sure that your experience, your quality of your experience matches the type of practice that you are willing to launch. Patient safety is absolutely number 1 whenever we are launching a telemedicine practice, any type of practice. Patient safety always comes first, protecting your license comes second. In order to do both of those, you have to take a moment and be very honest with yourself and identify your weaknesses and your strengths. Once you identify those weaknesses, do not, I repeat, do not offer those services in your practice where you will be the sole provider, because you will not feel comfortable with those patients, with treating those patients, ultimately putting them at risk. If you are a nurse practitioner looking to launch your very own telemedicine practice on the side, please take a moment to download my Ultimate Telemedicine Startup Guide. It is fantastic, gets your mind rolling, and will help you in the right direction. I hope you enjoyed this video. I hope I was able to add some value to you today. Please don't forget to like, subscribe, and share. Turn those notifications on so that I can continue to provide you with as much information as possible so that you can live a life of time freedom and financial freedom. All right, until next time.